All right, moving on about the abducent nerve. I should probably learn how to say it if I'm doing these videos. I think it's abducent. You could call it abducent. Someone look it up. Abducens, abducens. I feel like abducent is more, sounds better. 7 is the facial nerve. This is obviously in the face. Function, muscles, the face and scalp, stapedius muscle, posterior belly, digastric and xiphoid muscle. Taste from the anterior, 2/3 of the tongue from the floor of the mouth and palate. Ooh, that was on the test actually. So the scenario was, kid gets in a car accident, bites off the first 1/3 of his tongue, but this is the anterior 2/3 of the tongue from the floor, mouth, and palate. So anterior means it's in the front, which I guess it's the facial nerve? Did I get that wrong? I thought it was hypoglossal. Taste from the, he said he can't feel pain. I don't know. Submandibular and sublingual salivary glands, the lacrimal glands, so that makes tears, this makes spit. Yeah, glands of the nose and palate, it makes mucus in your nose, boogers. Internal acoustic meatus and facial stylomastoid foramen attaches to the pons in the brain. And then the effects of damage, the inability to control facial muscles, I have it right now because I can't even say the word, distorted sense of taste. Bell's palsy, this was on the test. I don't know why I'm excited. Okay, paralysis of facial muscles of the affected side, loss of taste sensation caused by herpes simplex virus. Don't get that, not even once. Lower the eyelids, droops, corner of the mouth sags, tears continuously, and eyes cannot be completely closed. Tears continuously, so lacrimal glands. Condition may disappear spontaneously without treatment. Oh, I got that dead wrong because it was between Bell's palsy. I think I was thinking cerebral palsy, but it wasn't that. Maybe it was muscular dystrophy was the answer. Facial nerves. This is your intermedius to your geniculate ganglion. Connects to your pituitary-palpitan ganglion, goes to the lacrimal and nasal. So we're in the nose now. Let's back it up. Afferent, parasympathetic, afferent, sympathetic. I don't know what efferent and afferent means, but you could tell where the, okay, so here we have the parasympathetic, and then these are the stimulated nerves. So I'm guessing there's not really anything heightened sense in your nose. That's all relaxing, but your eyes are going to dilate whenever you need to see more. So this is going to your eyes. I guess it's going to your tongue too. Facial muscles, xiphoid, digastric, cordia tympani. I'm about to look up efferent and afferent. I don't even recognize that from this year, anything I learned. So efferent means the opposite, used to describe parts that carry or lead things away from organs. Is it like arteries versus veins? Afferent neurons carry information from the sensory receptor and organs to the central nervous system. Okay, so I'm touching the screen. Because I just touched it, it's sending the message of it touching the surface to my central nervous system. That is afferent. Efferent is telling my hand to go to the TV to touch it. Afferent is once, now I got it mixed up. This is afferent touching it, and then me telling it to touch it is efferent. Afferent carry information, yeah. Afferent is away. Away, afferent, away. But it carries it away from your sensory. Vestibulocochlear is 7. I thought we already went through 7. I think we're just making these up. Vestibular nerve, it is the sensory nerve. Function, position and movement of the head. The opening in the skull, the internal acoustic meatus, cochlear nerve. So we know we're in the ears now. The organ of corti, hearing, opening in the skull, internal acoustic meatus. Here we are. All right, so you got your utricular nerve. that connects to this whole shebang here. Your vestibular ganglia, I guess it's only two of them. Vestibulocochlear nerves connect to the vestibular ganglia, the cochlear nerve. Scala tympani, think of like a timpani drum, like doom, 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 that. Scala vestibuli, your spiral organ of Corti, spiral ganglion, here's another ganglion. Heliocentrema, and your oval window, your spiral ganglion, more ganglions, cochlear duct, ampullary nerve. So I guess this amplifies sound. Kind of want to look up each of these. Let's do that. Not each, let's pick three. We're going to pick three. Crap. Let's look up what a ganglion is. A group of nerves forming a nerve center, especially to one located outside of the brain or the spinal cord. So it is where all the nerves would congregate, right? I got 5 fingers. Each of those nerves probably go to a ganglion somewhere in here. All right, let's look up ampullary. Ampullarius anterior. Transmit sensory information of the ampulla anterior semicircular canal. Yes. Tell me more about it though. Illustrations dedicated to anatomy. All right, let's try this. Let's see what the UK has to say. Is a branch of the cranial nerve 8 and innervant cristae ampullaris. Can someone explain it though? All right, let's try this. Ampullary tumor. Refers to either benign or malignant neoplasms that arise from the glandular epithelium of the ampulla vater. I think that means father in German. Ampullary carcinoma. Treatment prognosis, it's not really going into anything. You know what, we're just gonna move along. We did 2. Auditory pathway, the central auditory pathway is the medius geniculate nucleus, inferior collicus, lateral lemniscus, dorsal, cochlear, nucleus, ventral, superior olivary, ventral. That was a question. What did that mean? The front? Now I gotta look that up. That was a test question. Is it ventral versus dorsal? Ventral versus dorsal. Yes, I think we're in the right path. Okay. The main difference between dorsal and ventral is the area of the body in which they preferred. So the ventral refers to the front of the body. All right, I got that right. I've never heard that word before. I read it on the test yesterday. I knew what dorsal meant because dorsal fin on dolphins, obviously the back. But just using deductive reasoning, I came to the conclusion it was ventral, but now I could conclude it because here's the answer on Wikipedia. Yep, auditory pathway, more words, look at all these big words, trigeminal, hair cells, I'm kind of over this chapter. Damage to the vestibulocochlear nerve may cause the following symptoms. So you may have hearing loss, because obviously it's where your ears are. Vertigo, so that is where you can balance, like your body's, without a better word, your, what is that thing called? It's in airplanes. Your gyroscope, your gyrometer, whatever the hell like makes you know what up is up, down is down. That is where your ears are. You have little nerves in suspended gel that can tell whether you're upside down or not, and you feel vertigo. That's why whenever you're on a boat, it's rocking up and down, you get seasick because your body's just like, bro, what are we doing? False sense of motion. I've had that before after riding. Oh, you know what? Whenever I got my bike the first time and I rode it all day long and I laid in bed, I felt like I was still like rocking up and down in my bed. Loss of equilibrium in dark places. Nystagmus. I have no idea what that is. Motion sickness. Gaze evoke tinnitus. So I guess you hear things when you're looking at something, like you'll hear noise. What was the other one? Nystagmus. Let's see what this is. A condition in which your eyes make rapid, repetitive, uncontrolled movements, such as up and down. Interesting. Can cause problems in your vision. I don't think I've ever had that. You know what? I remember at one point when I was driving my car, I first started driving, I was like 16. I don't think this is the same thing, but it's like, I would be riding up and I swear the car was like, it wasn't like a smooth whenever I'm stopping at it where, you know, you kind of come to, it was like my frame rate in my head would dropped from like 60 to 30 or something, where the car felt like it was like frames coming at me, you know, like jagged instead of it being like a smooth whatever as I was braking to it. But I don't know, it went away. So thank you, Jesus. Pathologies: hearing loss, central auditory processing disorder, CAPD, tinnitus, presbycusis, nystagmus. Let's look that up. I want to know what that is. Presbycusis. Presbycusis. Hearing loss. Is that it? Age-related hearing loss, or presbycusis. Presbycusis. It's Wikipedia. How do we say it? It is Greek. Origin, orthohenergology. I don't know how to say any of these words. Ah, here we go. It didn't even say it. All right, whatever. Let's go into the pregnancy chapter. 9:11, glossopharyngeal. Here we go. General sensation and taste from posterior 1/3 of the tongue and pharynx, carotid sinus, carotid body chemoreceptor. So 1/3 of the tongue posterior. So the back of the tongue, glossopharyngeal. It's where like you talk and say words and stuff. Yeah. Clinical test: gag reflex, swallowing, coughing, difficulty swallowing. Cranial nerve 9, glossopharyngeal. Jugular foramen, superior ganglion, inferior ganglion, optic, carotid sinus. Nickname: Wanderer, Vegas. All right, after this one, I'll stop. Motor sensory: heart and great thoracic blood vessel, the larynx, trachea, bronchi, and lungs. Alimentary tract from the pharynx is a splenic flexion of colon and liver. Kidneys and pancreas. Opening in the skull, the jugular foramen. Effects of damage: hoarseness or loss of voice, dysphagia, cardiovascular problems, digestive problems, urinary incontinence, which means you can't shit. Deafness, palatal function, gag reflex, spastic dysarthria. Gag reflex: normal reflex consisting of elevation of the palate, retraction of the tongue, and contraction of the throat muscles. And you have different branches. So you got your auricular nerve, your pharyngeal nerve, superior laryngeal nerve, your superior cervical cardiac branches of the vagus nerve, inferior cervical cardiac branches of the vagus nerve, recurrent laryngeal nerve, thoracic cardiac branches to the pulmonary plexus, branches to the esophageal plexus, anterior vagal trunk, posterior vagal trunk. I don't know what those are. What is your vagal trunk? Can I click on this? Nope. That'll be the one that we look up now. What is your vagal trunk? She got some junk in her trunk. Wow, that is a lot. I kind of want to go into this. It's a little blurry. I'm sure you can't even see that. It's interesting. I just wish it was clearer. All right, let's stop there.